Hello everyone. The kidneys are amazing organs. They work silently, filtering blood, removing waste, keeping the body's fluid balance, and keeping normal levels of electrolytes. But what happens if there is a disturbance of the minerals and salt concentration in the urine? What happens if they crystallize inside your kidney? That is when your kidney forms stones, a condition that is known as renal calculi, nephrolithiasis or urolithiasis. I'm Ume. Before we start, please subscribe to our channel so the next time you will be updated with our new releases. Kidney stones can affect any part of urinary tract, starting from the kidney down to the urinary bladder. It originally forms where the urine becomes concentrated and minerals and salts stick together and crystallize, forming hard deposits. Then, stones can move from a place to another according to their size. You might have heard about how hard it is to pass a urinary stone and how painful it could be. However, a urinary stone will be silent with no symptoms until it moves within your kidney or passes into the ureters. If the stones becomes lodged in the ureters, it will block the flow of the urine from the kidney to the bladder, and it will cause back pressure on the kidneys. Consequently, the kidney will be swollen and the ureters will spasm, resulting in severe pain in your lower back, where your kidneys are located, known as the renal colic. Our role today is to answer most of your questions regarding urinary stone disease. Today we have Dr. Park, who is a leading doctor at Hanyang University Hospital in Seoul. He's going to discuss with us about urinary stone disease from an experienced medical point of view. So, Professor, can you a little bit tell us about what is urinary stone disease?
In our bodies, we can develop stones in various places. There are two types of stones that people are familiar with. One is gallstones that are in the gallbladder. You've heard of it, right? Urine is produced from the kidneys, descends through the ureter and collected in the bladder, and then exits. During this whole process, whatever urine-related stone is produced, we call it urinary stone.
How about the symptoms of the urinary stones and maybe the treatments afterward?
For urinary stones, the treatment is not just one method. Like I mentioned before, if there are stones in the kidney, we call it kidney stones. If there are stones in the ureter, we call it the ureter stones, and if there are stones in the bladder, we call it bladder stones. So according to the location and size, there are many ways for treatment. When there are stones in the kidney, you have no symptoms at all. But because these urinary stones exist in the path of urine, symptoms arise when it interferes with the urine flow. So even if these stones are in the kidney, if it doesn't interfere with the urine flowing down, there is no problem. However, if it blocks the way of the urine flow, just like a clogged sewer, it makes the urine flow upwards instead of which causes pain. But the pain of the urolithiasis is so severe, like that of labor pain. So the pain is in both left and right sides of your back. On the back of the ribs, you have your kidneys. This is where it hurts. And that is the main symptom. If these stones come lower down and block the way of urine, even urinating can be impaired. Earlier I said that hematuria can occur in bladder cancer. Urolithiasis can also cause hematuria, but characteristically, this one hurts. So hematuria in bladder cancer is painless, but the biggest symptom of urolithiasis is pain, including in hematuria.
So, doctor, you talked about the types of urinary stones. Can you tell us a little bit more details about the types?
So many of us know that there's lots of calcium in stones. In fact, around 70% of what makes the stones is calcium. And calcium is the same ingredient as our bones. So just like our bones are very visible on x-rays, 70% of urinary stones are easily visible. But we eat a lot of meat and high-calorie foods. And a metabolite of protein produced by eating meat is called uric acid, which is also closely related to a disease called gout. And this uric acid does not show in x-rays. So a CT scan should be done to check. So the main ingredient is calcium, but it also contains other ingredients such as uric acid.
So is there any examination we can do to know if we have urinate stones or not?
If you already have clear symptoms, in some cases, we can already assume just by looking at how the patient walks in pain. Usually we do an x-ray as we can see 70% of the stones on the x-ray. But if it is hard to tell or it is unclear whether they are stones or not from the x-rays, you must do a CT scan. If you take a CT scan, over 99% of the stones can be diagnosed. As I said earlier, there are various ways of treating stones according to location and size. So it's not just a matter of whether you have stones or not, but we need to examine where it is exactly located, how big it is, and what it's surrounded by to treat it accordingly.
So in this case, what are the treatments used? And after the treatment, is there any diets you should follow?
Yeah.
The most common treatment is to let it disappear on its own. Stones that are around 5 millimeters, as small as sand, can disappear by itself if we drink lots of water. But even if the stones are out and the treatment is finished, the state of the body does not easily change. This change only comes from daily effort, and the main one is drinking plenty of water. An ingredient of urine turns into stone, just like salt is formed from seawater. So whenever the case, we must drink plenty of water to dilute urine and also help drain out small stones quickly. We also recommend drinking 2 to 3 liters of water a day, which is actually a huge amount. It is good to always drink lots of water. But when drinking water to specifically drain out small stones, it is better to drink large amounts at once rather than little by little. On the internet, it is rumored that drinking beer can help drain out stones. But I'm not saying we should drink lots of alcohol. I'm saying drink lots of water at once to increase the amount of urine so that the stones can be drained out. So when you have stones, that is the way to do it. But normally, you should be drinking 2 to 3 liters of water a day. Another thing that makes it a good condition for stones to form is salt. Salt itself doesn't create stones, but consuming a lot of food that contains salt increases calcium excretion in the urine. And as calcium is the main ingredient of stones, the saltier food you eat, the easier it is for stones to form. As mentioned before, uric acid can also develop. And this is closely related to meat, so if you have lots of stones, you need to cut down on meat. Also, oxalate contained in foods such as nuts are known to have an effect of clustering stones, so it is said to cut down on food that contains such ingredients. There are also helpful ingredients like citrus fruit such as lemons or oranges. We call it citrate. Citrate is in citrus fruits like lemon or oranges, and this is known to have such a strong and positive effect on preventing stones that there is even a medicine made with this ingredient. So if you normally drink orange juice or lemon juice, it can help prevent stones. And lastly, preventing obesity and exercising regularly can also help prevent stones.
My last question. So, in this case too of urinary stone disease, are male more likely to have it than female?
This as well. Men have it more often. It is twice as common. But there is a period when women start to have it similarly to men. This is after menopause. The female hormone, which only women have, is effective in preventing stones from occurring. So this is why young women don't usually have stones, as they have female hormones that are superior to men. But women eventually reach menopause when they get older, and as you lose female hormones, the effect in preventing stones become ineffective. This is why women increasingly have stones as they get older. So normally, drinking plenty of water is important, but also strongly advised, especially after menopause. But usually, men have it more often.
Thank you, Professor.
You're welcome. Thank you.
Urine is produced from the kidneys, descends through the ureters, and is collected in the bladder, and then it exits. During this process, when urine-related stones are produced, we call it urinary stone. When there are stones in the kidney, you have no symptoms at all. But because this urinary stone exists in the path of urine, symptoms arise when it interferes with the urine flow. So, even if these stones are in the kidney, if it doesn't interfere with the urine flowing down, there is no problem. However, if it blocks the way the urine flow, just like a clogged sewer, it causes urine backflow, which causes pain. If these stones come lower down and block the way of urine, then urinating can be impaired. Many of us know that there's a lot of calcium in stones. In fact, around 70% of what makes the stones is calcium. And calcium is the same ingredient as our bones. So just like our bones are very visible on X-rays, 70% of urinary stones are also easily visible. The most common treatment is to let it disappear on its own. Stones that are around 5 millimeters, as small as a piece of sand, can disappear by itself by drinking lots of water. There are also helpful ingredients like citrus in citrus, fruits such as lemons or oranges, which are known to have such a strong and positive effect on preventing stones. That there's even a medicine made with these ingredients. So, if you normally drink orange juice or lemon juice, it can help prevent stones. And lastly, preventing obesity and exercising regularly can also help prevent stones. Thank you for joining us in yet another video covering key health-related topics with Cloud Hospital TV. If you have any questions or comments, please leave it below and we'll respond to you as soon as possible.